Stay informed, stay healthy, stay empowered. Topical discussions from nutrition, mental health to fitness to family planning and battling chronic illnesses with top professionals, expert advice, and practical solutions to today's most pressing health issues. We bring you the knowledge and tools to take control of your health only on Global TV. Low back pain can stem from various causes, including muscle strains, structural problems, and conditions like arthritis. However, the nature of this pain changes when it triggers by specific activities. For instance, what if the pain flares up after sitting for an extended period or during high impact activities? When does this become a cause for concern? What are the alert signals that should be taken seriously when the pain is severe, persistent, or accompanied by other symptoms? Welcome to Health Guide. I am Jumai Manson. I am being joined by Dr. Kristen Madubueze, a chief consultant orthopedic surgeon at the National Hospital Abuja and a part-time honorary consultant at H2 Specialty Clinic at Socorro. Don't go anywhere. The program Health Guide continues shortly. Stay informed, stay healthy, stay empowered. Topical discussions from nutrition, mental health to fitness to family planning and battling chronic illnesses with top professionals, expert advice, and practical solutions to today's most pressing health issues. We bring you the knowledge and tools to take control of your health only on Global TV.
I've had back pain due to lengthy motorcycle bike riding. And so that troubled me for some months. And I had to go to the hospital. They stopped me from riding bike, from driving car. And that is how they gave me some exercises to be doing and some treatments.
The work I do is sometimes if I wake up in the morning, so I feel back pains and body pains sometimes at times. So once I have seen it that like that in the morning, so I will need to use just paracetamol or any back pain relief drugs.
Sometimes if I do like this, e do me good. Sometimes if I do handwork, they pay me well.
And when it happens like that, I go to see my doctor that I'm having this challenge, and he just prescribe some drugs for me and take.
Sometimes I use like pain relief to cure it.
So I use paracetamol and just do exercise, and
It goes away.
yeah, it goes away pretty much.
I went to the hospital though. The drugs they prescribed didn't work. So it was one of my friends who told me what to do. So actually when I do the exercise and everything went off.
All right, you're welcome back. And if you're just tuning in, this is Health Guide on Global Television. And like I mentioned before, I'm not doing it alone. I have Dr. Kristen Madubueze here with me. He is a consultant and, of course, a surgeon. Good evening, sir. How are you doing today?
I'm fine. Good evening to you and all the viewers.
Now, talking about a very serious issue, low back pain. What are the causes?
Well, low back pain has so many causes. Some people have estimated that more than 40 to 50% of people will experience low back pain in their lifetimes. It is the commonest cause of people looking for disability from work. And the causes could be specific. Maybe there's a specific problem, like the person had an injury with a fracture or a sprain, or maybe has an infection, or sadly enough, a cancer or a tumor growing there. But most commonly, it's what we call non-specific low back pain, which means the cause is not very clearly known. And this tends to have symptoms that we can look at. People present with the pain. We ask them, how long has the pain lasted? What are the symptoms associated with it? We may not always investigate them the first time we see them, and most non-specific low back pain will recover with just drugs, treatment, activity modification, and so on. It is the more severe ones that need further action.
Now, how can I tell when the low back pain is very serious?
Okay.
At what point?
So the person has had back pain. Let me not say you. The person has had back pain for a long time despite treatment, or the pain is getting worse despite treatment, or now the person is experiencing symptoms like numbness or tingling or loss of power in his lower limbs, or even problems controlling his urine or stooling, or the person has other diseases like a fever along with it, or he's having low back pain and suddenly notices he's losing weight and is not on a diet, or the person had a cancer before, maybe breast cancer, thought he or she was treated and now has low back pain. All those are flags to show that this is not just simply non-specific and we need to do something about it.
Talk about low back pain, which is very normal and natural with many of us. And sometimes we tend to take it for granted. We feel we don't need to see a specialist, or we can just allow it go naturally. Sometimes it goes, but are there any effect around it without seeing a specialist and allowing it to just heal on its own? What are the effects of that in the later year of life?
Okay, so for non-specific back pain, there isn't really anything to worry about with just managing it. In fact, most of such cases will be managed by a general practitioner, and the patient gets fine, everybody is happy. It will be those cases that have something severe, or maybe they have a problem with the disc in their spine, they've had non-operative treatment, it's not going away, then those ones need to come. So generally, if you get better from back pain, fine. Nobody is going to really insist you still go ahead and see an orthopedic surgeon.
Now, what are some effective treatments when it comes to someone with severe low back pain?
The treatments have evolved over time. Most times we would start with drug therapy, but it's a multimodal treatment. It's not just one thing. And of course, painkillers are part of it, depending on the person's alter status. There is some controversy on whether we should use drugs like muscle relaxants or not. Sometimes they work, especially if there are spasms in the back. There are supplements we use to resurface the nerves. And there are also some other drugs that work on pain in different ways. All these tend to help. But apart from drugs, we do a lot of other things for the low back. We try to modify the activities that bring it on, like the way the patient bends down to pick things or carries heavy loads. In olden days, we used to prescribe sleeping on very hard surfaces. Now we don't do that. We just say any medium firm mattress is fine. And then for some patients, they benefit from physiotherapy, which would include exercises, sometimes application of deep heat through diathermy or infrared lamp, and sometimes manipulation. And if all these don't work, we move on to more invasive things like giving steroid injections if we can find the particular joint that in the spine that's causing the problem, all the way to surgery, either to decompress the spine or to remove the cause and so on. So it's just one step after the other.
So low back pain can actually lead to surgery.
Yes.
And for some who decide to self-medicate, what will you say to individuals that feel maybe a pain reliever and just manage it? Can you actually manage a back pain for a long period of time, even when it is very, very painful?
No, you shouldn't. One is that if it has lasted longer than 2 weeks on drugs you bought at home, it's time to go to the hospital. There are reasons why, because it may not be non-specific low back pain. It could be a tumor or a cancer, and you need to act on it early. Also, even if it is something like a disc problem, taking or arthritis in the back, which also happens, taking some of these painkillers for an extended period causes another set of problems. A lot of them cause eventual kidney damage, and then the person comes down with that. So it's good to see a specialist who will help you now decide that, okay, you've had these drugs for long enough, it's time to do something else, more invasive and something more likely to work.
Now, some individuals get it all mixed up, especially when we're not in the medical profession.
Yeah.
And we just feel once we have anything that has to do with our joints, our back, we just feel a regular doctor. So now who is the right, I already know the answer, the right specialist to see or visit when you have joint pain, back pain, or the burn? So is there a specific or any other doctor will suffice?
So the best doctor to see for such complaints will be an orthopedic surgeon. And even amongst orthopedic surgeons, there's what we call subspecialization. So some surgeons specialize on the spine, actually.
Oh.
Some specialize on other joints, but all orthopedic surgeons can treat spine problems to some extent. Now, because the orthopedic surgeons on earth are limited, it will not be practical to say everybody that has a low back pain, which affects at least 40% of the population, should see one. So we expect that they will see a qualified doctor first, who would then refer them once he notices that, oh, I can't cope with this. That is the typical pattern. But unfortunately, most people in our country self-medicate.
Yes, we do.
Or we go to the pharmacy and tell them, mix this for us.
Yes.
And the pharmacist does whatever they want to do.
Which is wrong, by the way.
Yes, but that's what happens.
Yes.
Or we go by ourselves to the lab or the x-ray department and then ask them to give us a prescription. It's what our people do. And if it's not specific pain, you may be lucky, it may go away. If it's one of the others, then it may not. And when you do decide to come to hospital, it may be late.
Back pain, they say, comes with age. Some people, once they get older, they experience joint pain, back pain. Is it normal, though, that at the age of, let's say, from late 40s to early 50s to late 50s to early 60s, they experience all of these pains? Do you get such cases, and is it normal?
Yes, I would say it's normal to some extent. The disease we call arthritis develops in most joints. And while it's not exactly wear and tear of cartilage, but we do notice it more with advancing age. Sometimes there's also some genetic component, which means, maybe your parents had arthritis at an early age, you are likely to have it. And if you just pick anybody at random and do an x-ray at 70 of his joints, you will see arthritis there.
Really?
But he may not have pain.
Okay. I think arthritis,
the two are different.
I'm sure arthritis has to be another different topic for another day.
And the x-ray may not even correlate with the amount of pain. One guy may have what looks like a mild x-ray and he's screaming. Another guy has very severe changes on x-ray and he tells he's fine. But it's going to be there.
Now, how can one prevent back pain? What are the healthy living that you can actually possess to avoid it at an early age or later in life?
So first and foremost, don't be like me, get slimmer.
Really? Exercise.
Yes. And diet.
But you're not on the big side. I think
exercise and diet. That's number one.
Okay.
And the exercises may not need to be exercises that strain your back. So being a weightlifter is not really very good on your spine. Then, of course, some sports that will injure the spine, perhaps don't engage in them. Sleeping postures and the type of bed you sleep in are good. Having a proper chair at work with a straight back and maybe a throw pillow helps. And then trying to limit sitting down or lying down. In fact, it's better to lie or stand, not sit. So if you can get up every hour, if you spend hours at the computer, for instance, every hour you get up for like 5-10 minutes, you reduce the chances of you having these joint pains and try to remain active.
Interesting. All right, let's quickly go on a very quick break. right, you're welcome back. And if you're just tuning in, this is Health Guide on Global Television talking about low back pain. And if you're wondering what's this all about, well, you have missed a lot because my guest has thrown in more light on sleeping positions, not self-medicate. It's better you see a specialized doctor when it comes to this particular issue. And if you're wondering who my guest is, no other person than Dr. Kristen Madubuize, a chief consultant, orthopedic surgeon at the National Hospital Abuja and a part-time honorary consultant at H2 Specialty Clinic Asokoro. Thank you so much, Doctor. Thank you for being a part of Health Guide. Now, for someone out there who has been with this low back pain for years and is trying so much to manage it, what can you say to that person?
Okay, so if it's non-specific low back pain, I would say to that person that while, or if it's from what we call spondylosis, while the disease is not curable, but it can be managed, and that is our target, to such a point that the pain doesn't interfere with his daily activities and it doesn't cause him any distress. So it's not curable, but it can be treated and managed, and the person can live a normal life if it is non-specific back pain.
Talking about back pain and how severe it can get, you mentioned something about cancer. What is that all about? How do they correlate? Cancer, back pain, how do you... I do not understand. I'm trying to understand that part.
Okay, so, well, cancer is a layman's term for what we in medicine will call a malignant or a tumor. And as it relates to the back, it could be a tumor that primarily started in the back, or a tumor that is spreading from somewhere else, which tends to be commoner in the older age groups. Spread to the back usually occurs by the blood vessels. So if someone has a breast cancer or lung cancer or ovarian cancer, it would, or from any of those organs, it would enter the blood vessels around the tumor and go and seed in the spine. And this happens because the spine has a unique type of venous drainage that has no valves and allows tumor cells to settle there. And unfortunately, when this happens, it tends to mean for most of these patients that the cancer is not curable for these patients that it has spread. But of course, they can be treated, life can be prolonged, but curing them is probably not likely. It is something we need to act on quickly because back pain from cancer tends to be progressive and it continues damaging the bones and eventually the spinal cord itself, leading to paralysis and other complications and of course eventually death.
Now, talking about the cancer, that low back pain that can lead to cancer, all of that. Does it come at once or is it a gradual thing, little by little? It makes you think that it's a one-off thing, it can heal itself naturally. What are the signs that will make an individual understand that it's leading to cancer, the back pain?
Well, there are no clear signs that are 100% because sometimes people will hear, oh, it's this sign, and every back pain they have, they think it's that, and it's not necessarily so. But if the person already had a cancer before that they know about and they develop back pain, then they should immediately look for expert care to be sure that back pain is not a spread to the spine, which technically we call a metastasis in our own parlance. Now, for those who don't have that, it could come in a myriad of forms. Unfortunately, for some people, it's actually quite silent until it's far advanced. Or it could come with pain that is relentless and continuing to increase in spite of treatment. Or it could come with nerve problems, eventual paralysis. And some of them are associated with weight loss that you can't explain. But it's not enough to take these symptoms in isolation. For instance, there are other diseases that are not cancer that can cause everything I've said. Tuberculosis of the spine can cause everything I've said, including the weight loss. And it's a curable infection. So it's important to say that we don't want people to have these symptoms and immediately get paralyzed with fear. The solution is to get to your specialist and get properly investigated.
Now, tell us some healthy lifestyles one can actually embark on when it comes to avoiding all of these issues, from low back pain to joints and all of that encompass.
Okay, so healthy lifestyles include, number one, maintaining a healthy weight. 2 is activity. Most authorities prescribe at least 30 minutes of exercise a day, maybe 3 or 4 times a week at the minimum. Now, this exercise doesn't need to be high intensity, hardcore gym workouts. It could just be walking. Maintain activity. Avoid sedentary postures for too long. Get up from time to time and do something different. Improve sleep habits. People should sleep early and sleep at least 7 hours or more per day. Of course, it goes without saying that recreational drugs, alcohol, cigarette smoking, and so on are not healthy. If you can avoid them, do so. And then heavy lifting or things you know that would cause you pain, avoid them. And then we've talked about organizing your home and your office to be what it's not a medical term, but it's more of an engineering term, ergonomics. That is something that fits what your body needs, having the right type of chair, right type of table, right type of bed, and so on. So those are a few of them.
Now, for someone out there whose job entails him standing for a longer period of time, like you mentioned, sitting down, when you sit down after an hour, you can get up, take a walk, or get pillows, or get the right chair and all of that. For someone that, okay, fine, my job doesn't entail me sitting down. It entails standing for a very long period of time. How can that individual, one, manage that, and two, can that lead to low back pain?
So unfortunately, any sustained posture can lead to low back pain. Now, if somebody has to stand for a long time, can he take breaks where he can sit, or can he walk? If you are going to stand for a long time, it may be good if you can walk around. That unloads the joints that are being stressed, or if you can sit. And then now, for the ladies, there is something that needs to be avoided to stop low back pain, and that's high-heeled shoes. I'm sure this is an unpopular statement, but
I don't think we want to hear that part.
But it is a fact.
Really?
If you come to me with low back pain and it's non-specific, one of the things we'll be telling you to do is to start planning to buy new shoes, flat shoes.
Okay. All right, with that, we've come to the end of the program. Thank you so much, Dr. Chris Madubueze, for being a part of the program. And of course, he is a surgeon at the National Hospital Abuja and a part-time honorary consultant at H2 Specialist Clinic at Socorro. Now, with that, low back pain can arise from various causes, including muscle strain, structural issues, and conditions like arthritis, like I mentioned before. Now, the severity and nature of the pain can vary, triggered by prolonged sitting or physical activities. It's crucial to take the alert signals seriously when the pain is severe, persistent, or accompanied by other symptoms. Now, early intervention and proper management are key to addressing low back pain effectively. I am Jumai Manson, and thank you so much, Dr. Kristen Madubueze, for being a part of the program.
Thank you for having me.
Have an amazing day ahead, and remember, your health is your priority. Bye-bye. Stay informed, stay healthy, stay empowered. Topical discussions from nutrition, mental health, to fitness, to family planning, and battling chronic illnesses with top professionals, expert advice, and practical solutions to today's most pressing health issues. We bring you the knowledge and tools to take control of your health, only on Global TV.